Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Cortical dementia versus that of the subcortical dementia. So first let's look at cortical dementia. So under the cortical dementia, the site of lesion, it includes the cerebral cortex. So it includes the cerebral cortex. Then comes the frontal, temporal. So frontal, temporal. So the cerebral cortex, the frontal, the temporal, then the parieto-occipital, occipital, the association area. Then comes the hippocampus. So all these are used as a site of lesion. Then what is the higher cortical symptoms? The higher cortical symptoms is it includes aphasia. This is all with respect to the cortical dementia. So you have the aphasia, you have the apraxia, then come the agnosia as well as the calculia. Now motor symptoms there is none. The memory wise they have both recall and the recognition. So recall and the recognition, and they are impaired. Recall and recognitions are impaired. Now looking at the mood, it is almost normal. The mood is almost normal. So what are the examples here? The example is it can include the Alzheimer's dementia. So Alzheimer's dementia, then comes the frontotemporal. So Alzheimer's dementia, the frontotemporal dementia, and this is nothing but it includes the Pick's disease. It is the Pick's disease. Next is there is also the vascular dementia. So you have the Alzheimer's disease, frontotemporal dementia, that is includes the Pick's disease, the vascular dementia. Then the diffuse, you have the diffuse Lewy body dementia, as well as the Creutzfeldt-Jacobs disease, CJ disease, the Creutzfeldt-Jacobs disease, and also the chronic subdural hematoma. Now let's compare it with that of the subcortical dementia. Under subcortical dementia, it involves the thalamus, the basal ganglia, the brainstem as well as the cerebellum. Now what are the higher cortical symptoms? The higher cortical symptoms, it includes none. And looking at the motor is, it includes the dysarthria, the ataxia, as well as the rigidity and the dystonic tremors. So you have the dysarthria, ataxia, rigidity, the dystonic tremors. Now looking at the memory of the subcortical dementia. So in case of memory of the cortical, it was the recall and recognitions are impaired. In case of the subcortical dementia, so here it is the impaired recall. So impaired recall and almost normal recognition. Now looking at the mood of the subcortical dementia. The mood of subcortical dementia is there is significant depression. The significant depression as well as the presence of the anxiety. This is in subcortical dementia. Now what are the examples of the subcortical dementia? Examples of subcortical dementia, it includes the Parkinson's disease. So Parkinson's disease, the Huntington's disease, the multiple sclerosis, the HIV, the normal pressure hydrocephalus, as well as the progressive subnuclear encephalopathy, as well as the chronic meningitis. To learn and grow daily like this, please do subscribe.